Today our topic is on pulse oximetry. We discuss in this video indications, advantages, limitations, troubleshooting sources of errors. So let's go to start our lecture.
Audio Jungle. Audio Jungle.
Pulse oximetry. Pulse oximetry is a non-invasive and painless test that measures oxygen saturation level, or the oxygen level in the blood. The pulse oximeter is a small, clip-like device that attaches to the body parts, like toes or an earlobe.
Indications: endotracheal tube, cardiac arrest, procedural sedation, asthma or chronic obstructive pulmonary disease, respiratory complaints, acute respiratory distress syndrome, suspicion of pulmonary embolism, sleep apnea, heart failure. Advantages: rapid. Pulse oximeter is a rapid tool that accurately assesses oxygenation, particularly in emergency situation. Compared with arterial blood gas analysis, pulse oximetry also provide immediate result both before and after oxygen therapy. Non-invasive. Pulse oximetry allow non-invasive measurement of arterial hemoglobin saturation, without the risks associated with arterial puncture, like during arterial blood gas. Provide continuous data. Pulse oximetry, unlike clinical examination in an indwelling arterial catheter, provide continuous data such that the oxygen therapy can be easily adjusted to a target level. Limitations: inability to detect hyperoxemia. Pulse oximeter is unable to detect significant hyperoxemia. Inability to measure arterial oxygen tension. Since pulse oximetry does not measure PUSE, over-reliance on pulse oximetry can miss detection of clinically significant hypoxemia in adults, but particularly in children. Inability to measure ventilation. When pulse oximetry is a convenient way of measuring arterial oxygenation, it does not measure the arterial carbon dioxide tension, which is measure of ventilation. Dyshemoglobinopathies. Pulse oximetry is considered to be accurate when oxygen saturation is between 70% to 100%, provided oxygenated hemoglobin and reduced hemoglobin are the only measured species of hemoglobin.
Poor perfusion. Poor perfusion leads to poor arterial pulse waveform, and so the pulse oximeter fails to detect the correct oxygen saturation. This can be happen during cardiopulmonary bypass, cold extremities, hypovolemia, low cardiac output.
Arrhythmias. The pulse oximeter may not able to detect the correct saturation during rapid arterial fibrillation, or during intra-aortic balloon pump application. Miscellaneous. Black, blue, and green nails polishes give lower saturation. The movement of the patient, like shivering and seizures, will not give accurate measurements as the pulse oximeter fails to detect normal arterial pulsation. The hyperhemoglobin may show lower readings as capillary and venous flow becomes pulsatile. It cannot detect hypoventilation or hypercarbia despite good ventilation. Troubleshooting sources of errors. Inadequate waveform. Malposition of probe. Motion artifact. Hyperperfusion. Hypothermia. Skin pigment. Falsely normal or elevated oximetry reading. Carboxyhemoglobin. High level of glycohemoglobin. Methemoglobin. Ambient light. Skin pigment. Falsely low oximetry reading. Inadequate waveform. Methemoglobin. Sulfhemoglobin. Severe anemia. Venous pulsation. Ambient light. Nail polishes. Vital dyes.